Name one part of your body that is safe from cigarette smoking. Nobody has come up with an answer for me.
Nicotine dependence is a health condition and ought to be identified and aggressively managed as any other chronic medical condition.
Well, New York State Department of Health Tobacco Control Program has a campaign out that says, treat it. We're asking healthcare providers across New York State to encourage and talk to each of their patients who smoke about receiving effective treatment.
The latest ad campaign really emphasizes a key reoccurring message, and that is doctors need to identify smokers in a systematic fashion in their offices. Intervening makes a difference. The more you do, the greater the effect. But again, something as short as 3 to 5 minutes of counseling support can help to increase quit rates in a measurable way.
I personally incorporate smoking cessation counseling into everything I do with the patient. They come in with a cold and they smoke. The most important thing they can do for themselves at that time is actually to quit smoking. We have a sign right at when you come into this office. That alone tells them that something is going on here with smoking cessation. You know, among other risk factors we have that may affect somebody's health, that's pretty much the strongest one that you can change. And it doesn't cost anything to change it except wanting to change it.
I think having somebody that believed that I could do it, you know, beyond my own family and stuff like that, that the actual doctor who cared whether I quit or didn't quit. I haven't had a doctor that really cared whether I quit smoking or don't quit smoking, and she actually cares. So I think that made it to where when I came in, I didn't want to say, oh, I've been smoking, or I fell off and I'm smoking again, or something like that. I wanted to be able to come in every appointment and say, hey, I'm still not smoking. So pretty much everything in sight. So.
Yeah, talk about it, say something about it. Most importantly, let them know how much their health will improve if they stop smoking, and they will believe you. I think doctors are they have, more than everybody else, they have the greatest opportunity to impact on, this habit, smoking. Yeah. I've been lucky in a way. None of my staff smoke. Everybody's pretty much on the same page. We don't like the smell.
How are you doing today, Mr. Lee?
Fine, how are you?
That's good. I usually start talking to patients about smoking cessation during the initial interview. Have you ever smoked? Do you still smoke? When was the last time you smoked? Or are you interested in quitting? I don't think it takes too much time. Smoking is a disease and it needs to be treated, and it affects so many different people. People who who smoke, who have children, that affects the children. Frequent ear infections, asthma, so it affects everyone that's around. It's not just that person that it's affecting.
If there was one thing I could say to healthcare professionals, I would say it is worth the time. It is worth the 2 to 3 minutes in addressing tobacco with your patients, and we're here to help.
Our Smoking Cessation Center team go out and discuss with the offices, the clinicians, other staff, the array of services which are available. It can be everything from the office managing all of that cessation support themselves, or if the office says they're not comfortable or they're busy dealing with other health issues, you can utilize that Facts to Quit program. So there's everything in between.
Hello, thanks for calling the New York State Smokers Quit Line. My name is Eric. How can I help you?
We at the Quit Line are able to help someone who wants to quit and help them in a way that really enhances their chances of staying tobacco free.
Now, Walter, are you planning on quitting within the next 30 days?
So the Quit Line, because it's free, it's easy, we do the work for you.
That thought, 3 to 5 minutes, get up, move forward.
I got the nicotine patches and gum from the New York Quit Line. There's websites that you can go on and chat rooms and things like that, and they actually call you back and see how you're doing, which is nice.
The partnership encourages us. It helps us know that somebody else is already fighting this fight. We're not alone. It helps us also understand that this is real. The risk is real. Coming from Roswell Park, who else we know about what smoking does to the body but them? They see the cancers, they see what it does to people, and they know that we can prevent some of them, not all of them, but we can prevent some of them by just quitting smoking.
You know, we need to wake people up. We need to motivate them to change the way they approach nicotine dependence in their practices. It is a leading cause of multiple cancers, of heart disease, of COPD and emphysema, and of a whole array of other health conditions. If they can get patients to stop smoking, that will be more impactful than all of the prescriptions that we write each day.